Well, hot zones requires a level A level of protection. It uses a self-contained breathing apparatus, so the person inside is completely cut off from the environment outside. The suit is sealed at the face, and the gloves and boots are taped through the suit, making it a completely sealed environment. Level B, you can see in white, provided a self-containing breathing apparatus or supplied a respirator and splash prevention. The respirator is outside in this picture, as you can see. It is inside the suit, and in B it is outside the suit. There is still some chances of leak from, especially where the person is receiving his mask and gloves and the respirator. The level C is a maximum amount of personal protective equipment a hospital uses generally, and it includes a respirator, splash prevention, as well as a military grade gas mask. So there are certain chemicals, high risk chemicals, simple asphyxiant. Asphyxia मतलब क्या होता है, पेशेंट का ऑक्सीजन खत्म कर देना बेसिकली. So displaces oxygen from air like carbon monoxide, hydrogen, nitrogen, methane, butane, propane such gas. तो कुछ नहीं करना है, remove from the source and give oxygen. The gas will displace and patient would be fine. The irritant gases actually dissolve in water in the respiratory tract and then irritate the mucosa. For example, ammonia, chloramine, sulfur dioxide, HCl, chlorine, phosgene. We need to remove the from the source, give oxygen, and monitor pulmonary status. For HFI, I don't know what HFI is. Okay. And monitor serum calcium. There are agents that interrupt delivery of oxygen to tissues, very well known. Carbon monoxide, methylene chloride, nitrite, benzocaine, propanocaine. Treatment is methylene blue for methemoglobinemia. Then there are agents that interfere with oxygen utilization in the mitochondria. We all know cyanide. They bind to cytochrome oxidase and stage of ETC. Hydrogen sulfide, cyanide, phosphine, sodium azide, carbon monoxide. Treatment is hydroxycobalamin, vitamin B12. Nerve agents there are like organophosphates, which binds to acetylcholinesterase, GAGB, sarin, VXGF. Identify the dumbbells, give atropine, PAM, and benzodiazepine for seizures, ipratropium bromide for wheezing. Never give Sucol, remember. OP poisoning, no Sucol. So OP poison में identify dumbbells or sludge, give atropine for muscarinic, PAM for nicotinic, ipratropium for wheezing, and benzodiazepine for seizures. What is dumbbells? Defecation, urination, meiosis, bradycardia, bronchoria, bronchospasm. All three can kill. Lacrimation, salivation, emesis. PRAM or pralidoxime reactivates the enzyme acetylcholinesterase, but it needs to be given early to prevent aging of enzyme. It is given 1 to 2 grams slow IV over 20 to 30 minutes. And in a large event with multiple casualties, half of this may be given to spread the antidote to maximum number of patients. In normal person, a Sucol acts for only 90 seconds, but in OP poison, it acts for several hours. So no Sucol in OP poison. What are the possible indications of a Botox exposure? A disease or syndrome that rarely occurs. You can't identify it really. Multiple victim of same history with no classical risk factor occurring probably from the same geographic location. Epidemiology suggesting a point source, as I said. Possible animal and human morbidity in the same area. High mortality in otherwise healthy population. Start antitoxin early in Botox poison, because once the paralysis has occurred, the antitoxin will not work. It only prevents the progression of paralysis. It cannot reverse it. Next is bioterrorism. What is terror? Terror is a severe form of fear. So bioterrorism is release or a threat of release of a biological agent among the civilian population, which will cause illness or death in the humans or animals or destroy the agriculture. It will result in widespread fear and disruption of daily life. There are different classes of bioterror agents. Class A agents have the most severe potential and include viruses and bacteria like smallpox, which is variola, anthrax, Yersinia pestis, plague. So smallpox, anthrax and plague. Class B agents have less potential for causing widespread illness and death or are more difficult to disseminate, and class C agents are those that as technology improve could emerge as future threats. So first step is always recognition. Methods for detecting a biologic event include recognizing an unusual epidemic or clusters in a healthy or not so position, not so location among the group of people, such as a high incidence of non-specific illness, clusters, or large number of rapidly fatal cases, or steep infection curves identified through public health records. So class A agents are 6. First are pandemics that would wipe out humanity, almost wiped out, like plague, smallpox. None of us have immunity for smallpox in today's world. Anthrax, botox, tularemia, and filovirus. So plague, smallpox, anthrax, plague, tularemia, filovirus, and botox. Filovirus is your Ebola. Class B agents are your Coxiella, Brucella, Burkholderia, Rickettsia, Chlamydia. Like Coxiella burnetii, Brucella, Burkholderia, Rickettsia prowazaki, Chlamydia sattaki. Class 3 are your Nipah virus, hantavirus. This is your smallpox and this is your scar for cutaneous anthrax. Remember it. Anthrax has a widened mediastinum. क्लास ए एजेंट्स का ट्रीटमेंट क्या हो सकता है? तो वेरियोला मेजर यानी स्मॉल पॉक्स की वैक्सीन का नाम है वैक्सीनिया. इसके लिए ट्रीटमेंट है सिडोफोविर. एंड बैसिलस एंथ्रेसिस, एंथ्रेक्स का ट्रीटमेंट है लिनाजोलेट, सिप्रोफ्लॉक्सासिन, मॉक्सीफ्लॉक्सासिन. प्लेग का ट्रीटमेंट स्ट्रेप्टोमाइसिन और जेंटामाइसिन. बोटॉक्स का ट्रीटमेंट बोटॉक्स एंटीटॉक्सिन, हेप्टावेलेंट बोटॉक्स एंटीटॉक्सिन इज अवेलेबल. एंड एज यू नो इट प्रिवेंट्स progression of paralysis but does not reverse it. Tularemia का ट्रीटमेंट डॉक्सीसाइक्लिन, सिप्रोफ्लॉक्स एंड क्लोरामफेनिकोल. एंड इबोला का फाविपिराविर.